If you've torn your ACL and you're preparing for surgery, or you've been told that it might be the right option for you, understanding the journey ahead from the operation itself to the recovery stages can really help you feel prepared and confident. I'm Dr. James O'Donovan, and in this video we're going to talk through what ACL reconstruction surgery actually involves, why it's done, what to expect before as well as after the operation, and how you can support your recovery for the very best outcome. And just as a reminder, this video is a general educational resource only. Always follow the personalised advice from your own surgeon and physiotherapist, as every knee and every patient is different. So let's start with a simple question. What does ACL reconstruction actually mean? Well, inside your knee, you've got several important ligaments, and one of the most critical is the ACL, the anterior cruciate ligament. It's the one that helps to keep your knee stable, especially when you're pivoting, twisting, or changing direction quickly. Now, when this ligament tears, many people notice a feeling of the knee giving way. They may also describe a popping sensation, particularly when turning or during sport. And while some people can successfully rehabilitate without surgery, others do continue to feel unstable. And that's where ACL reconstructive surgery comes in. Now, ACL reconstruction involves replacing the torn ligament with a graft, usually taken from your own hamstring tendon or from the tendon just below the kneecap. So think of it a little like replacing a frayed rope with a strong new one, and then securing it inside the knee so that it can eventually function as your new ligament. Now, this surgery is done arthroscopically, meaning with keyhole incisions, and most people go home on the same day. But before surgery, there are some really important steps that you need to be aware of. Now, firstly, you're going to meet your surgeon and go over the procedure, the risks and the benefits, and sign the consent form, meaning that they've explained the risks, the benefits, and the intended outcomes to you. You'll also attend a pre-assessment where a nurse will check your general health, review your medications, and they might arrange for tests like bloods or an ECG, which is a tracing of your heart. Then you'll meet a physiotherapist who will show you how to use crutches and begin practicing early strengthening exercises, because going into surgery strong and mobile genuinely will improve recovery afterwards. So now let's move forward to the day of the surgery. Well, you'll arrive at the hospital, you'll meet your nursing team, the surgeon, the anaesthetist, and you'll change into OR or theatre clothing, and you'll head to the operating room. Now, most people don't stay overnight, but your team will guide that decision depending on your health and how you're going to recover from the anaesthetic. Now, when you wake up, your knee will be bandaged, and once your nurse has checked your pain and vital signs, the physiotherapist will help you to stand and take your first steps, typically using crutches. Now, before going home, you're going to need to have eaten and drunk, passed urine, and feel steady on your feet. And importantly, you must have someone to collect you and stay with you overnight. You can't travel home alone or on public transport. So what does recovery look like? Well, in the first couple of weeks, the aim is to reduce swelling, manage pain, and begin gentle exercises to regain knee movement and wake up the quadriceps muscle at the front of the thigh. You'll use crutches initially, and if additional structures like cartilage were repaired, then you'll also be given a knee brace. Now, your surgical team will explain exactly how long you need to use these supports, but everybody is different, so everybody's exact program is going to look slightly different. These are just general rules. Now, something really important to understand is that the graft takes time to become strong. In fact, between 6 and 12 weeks after surgery, the graft is actually at its weakest, so avoiding twisting, pivoting, or deep bending movements during this time is crucial. Now, a helpful rule often used in sports medicine to guide early recovery is called police. Protect the knee, gradually load it with movement and weight bearing as advised, use ice to reduce swelling, consider compression if recommended, and elevate the leg to help with swelling. Now, elevating the leg properly means resting flat with the whole leg supported, ideally with your toes above nose level for short periods throughout the day. Physiotherapy is absolutely essential. Whether your goal is simply to walk comfortably again or return to a sport that involves high levels of twisting like football or skiing, sticking to your exercises consistently makes a big difference to long-term success. So how long does recovery typically take? Well, most people are more comfortable walking within a few weeks, back to normal daily activities in a couple of months, and returning gradually to sport around 9 to 12 months after the operation. Again, this is different for everybody, but these are just general rules of thumb. Now, desk-based work might be possible after a couple of weeks, whilst physically demanding jobs often take significantly longer. And you shouldn't drive until your surgeon clears you and after you've practiced a safe emergency stop movement. It's also worth letting your insurance company know that you've had this operation. Now, before we finish, let's talk about some warning signs that could potentially indicate a complication following the operation. So firstly, if your knee becomes much more painful, swollen, hot or red, if your wound is leaking fluid, or you feel feverish or unwell, contact your healthcare provider. And if you develop calf pain or swelling, as well as shortness of breath, chest pain, or sudden breathlessness, it's important to seek urgent medical help immediately because these could be signs of a blood clot. So to summarise, ACL reconstruction is a highly effective procedure for restoring knee stability when the ligament has been torn, particularly in active people or those people for who the knee continues to feel unstable despite having physiotherapy. It isn't a quick fix and recovery will take time, commitment and structured rehab, but most people return to the activities that they enjoy doing with excellent function following surgery and consistent rehabilitation. If you're preparing for surgery or you're already recovering, I'd really love to hear how you're getting on. Please feel free to share your experiences in the comments section, and if you have any questions, please do so there as well. If you found the video helpful, please consider subscribing for more evidence-based health education. Until next time, take care.